Have you ever wondered how intertwining a business lens, the different sectors of healthcare, and then the clinical setting can all come together to actually help with innovation in healthcare, improving patient care, and just leadership in general? Then you'll want to tune into this episode. Let's dive in. Welcome back to another episode of The Leader Within. Today, I'm excited to introduce Dr. Shanil Ebrahim, partner of life sciences and healthcare consulting at Deloitte. He works internationally with public and private health sector and organizations in delivering large evidence-based strategies and implementing tech-enabled innovations. And given his experience in clinical epidemiology, consulting, and leadership, I'm excited for him to share his insights with you. Well, welcome, Shanil. Can you share with us a story that has really shaped the trajectory of your career? Whether it's, hey, like this was that light bulb moment that catapulted everything else, or maybe it was just one of those big learning curves that you had to overcome to get to where you are today.
Yeah, so when I think about one of my defining moments in my career is when I finished my PhD and when I went to Stanford in California for my postdoctoral fellowship. And now Stanford, being at the heart of Silicon Valley, it honestly could not have been more transformative experience for me. And that's what really opened my eyes to the potential of integrating healthcare, academia, and business. And at that time, I was already a clinical epidemiologist, deeply immersed in clinical research and working in the hospital sector. But being in Silicon Valley, where innovation is kind of in the air that you breathe, every person that I was speaking to, they're not trying to make $1 billion. They're really trying to change the world. And I know that sounds like a cliche, but when I was there, I really did see that's how every single person, irrespective of their level or their age or whatever it is, that's what they were trying to do. So, there's many times, when people have told me that Silicon Valley can be a bubble, but I see it as like an inspirational environment that forces you to think outside the boundaries. And it's the first time that I really saw how technology, academia, and business models were leveraged together to create an impact in healthcare. And it just wasn't about the medical research in the traditional sense. It was just about how research could be applied through, business to make real, scalable, and different changes in the healthcare system. So here's where I started to do a little bit of independent consulting with, tech startups and insurance companies, where a lot of the projects I was doing was how to use data and analytics for predicting patient outcomes. And these projects had direct implications for how healthcare providers could tailor their interventions. And this is where I really saw the power of bridging the gap between the clinical side, the business side, and also showed me what I could do when I was an independent consultant versus a medical researcher. And that's where I really grasped, what the potential could be if we did bring in the different sectors within healthcare and bring in the business acumen to actually tackle healthcare challenges. And that's what really changed my perspective and really shaped the trajectory of my career. And that's what led me to pivot into healthcare consulting, where I felt that I could make an impact on a grander scale, transform healthcare systems on a larger scale, and go from beyond the patient to patient research to seeing how we can actually change the landscape in the ecosystem, through a consulting firm as well. So, the rest is history from there.
I appreciate you sharing that story. And one of the biggest things I know is that when it comes to US compared to Canada, they're very ahead of the curve when it comes to innovation in health, tech, etc. Right? And I don't know if it's the resource aspect or whatever it may be. So when you were studying there and then you came back, did you find it difficult to brand yourself as a consultant and eventually become partner at Deloitte? Or did you find that it was actually very easy given the fact that you were potentially one of the few that was developing a name of yourself? Just before you answer, to provide some context to the audience, is that you've received a lot of recognition and awards for the impact that you've made. And part of that has been like top 40 under 40, etc. So going back to my question to you is going to the US where innovation is huge, like you said, with the intersectionality of business research, etc., and then bringing that back to here, did you find that it was difficult to brand yourself, or was it really easy because you're one of the few thinking the way that you were?
Yeah, to your question, around if I found it difficult, absolutely not. I really do feel that one of the best ways that you can make an impact, wherever you go, whether it's an organization perspective, into your society or just a broader country, is being able to take learnings from different places and being able to apply it. That's one of the reasons why some people who have worked across industries can come into healthcare or energy and resources or whatnot and be able to, be able to apply the innovation within the circles that they're in. Now, Obviously, there are fundamental differences and philosophies and policies that's going to be different. So it's not a lift and shift, but that's where the creativity and the leadership really starts to come into play. Now, in Canada, for example, we have a publicly funded healthcare system where we provide universal coverage for all Canadian citizens, right? And the system is funded through taxes and administered by each province or territory. In the US, predominantly private funded, majority of the citizens receive health insurance through their employers. And you can imagine access and equity are different. Now, it's amazing to say Canada has a lot of universal coverage, but one of the things that we talk about a lot of the time is wait times, which where in the US, cost of services are quite high. So when I'm coming from an area where innovation and funding is in abundance, relatively speaking, now coming to a place that is much more constricted and there are restraints around budgets and innovation is a little bit more stifled, how are you working within that environment means you got to change some of the criteria just in terms of what you can and what you can't apply and understanding what you start to prioritize as well, right? So that becomes quite important. And this is no different than any business deals with, right? Like if you go from a large corporation where funding is abundant and now suddenly you do a startup, you have a frugal mind. But it doesn't mean innovation actually stops. If anything, you realize how to actually navigate within it. And that's the whole art of how you actually bring these pieces together.
I want to dive into the leadership piece a little bit more. So, what inspired you to go down the partner route? And then,
In terms of what made me go into like a, let's say, partnership route first, right now I'm part of an organization, Deloitte, that serves all industries and globally. And for those of you who don't know what Deloitte is, we're now a team, 400,000, 500,000 individuals. I'm losing count right now. And in Canada, we have about 14,000 people. And in my role, I get to steer the ship for our life science and healthcare consulting group, which is a huge privilege because we go from everything from implementing AI, digital health solutions to reimagining what the workforce will be for organizations as well. Now, one of the best parts about Deloitte is we're a purpose-driven firm. Through our work, we're looking to make the lives of citizens better, and our work is rooted in strengthening our society and economy. And we do that by partnering with our clients. So in this case, healthcare organizations, whether it's public and private sector, to be able to solve some of the most challenging problems. What a partnership does, it provides a platform in terms of leading the direction, in terms of where we go and shaping the future of what healthcare is. And that's something, about 10 years ago, I would have never thought that I would be at the forefront of some of the conversations in terms of what does healthcare start to look like for Canada. And I have the similar conversations globally as well. And a partnership provides me that platform. And I see it as just building upon the journey that I've had because I've been very fortunate to be in roles as an epidemiologist, a researcher, a bioethicist, and now a partnership provides me a different lens and a different perspective just in terms of how I could serve better. And yeah, that's how it kind of came together. And I've been having a blast ever since just in this role. And I know it'll continue to evolve. And I think, especially given the economic conditions and the ecosystem evolving as well, it makes it actually a quite interesting journey just in terms of how it'll unfold.
how have you developed your leadership brand? Because you talked a little bit about, hey, this is the platform that now I have the ability to stand on and really make an impactful difference. So, how would you describe your leadership brand?
Yeah, in terms of how I define my leadership, and this is where some core attributes really start to come into play. And the first few ones that do come to mind are resilience, versatility, and just an unwavering ability to get things done. And these qualities are not just a foundation, my leadership, just in terms of my personal approach in general. If I were to break it down, as I think about resilience, and it's such an overused term now, it's more than just bouncing back. It's really about learning, adapting, and thriving in the face of challenges. And if we take us, one step further, I use reflective resilience quite a bit, which is, taking the time to reflect, not just on your setbacks, but also on your successes. And this isn't just about understanding, what has happened, but how it's going to shape our approach kind of going in the future. And I faced multiple challenges, throughout my career. And a lot of people focus on the different milestones or the achievements that I've had. And I'm very fortunate for those, but it was as a result of different things I had to overcome, whether I've had challenges in my research or being rejected, multiple journals who didn't accept that research, or to not getting into graduate programs early on in my career, or challenges with clients on just major strategies and implementations that just haven't worked out. And each of them allows an opportunity to reflect and see how I recalibrate what I could learn and how do I come up better. And I've always came up better, just as a result of, a lot of these setbacks, as well as, the successes I've had. The second one, and I talked to a lot of my folks in consulting about this, is the importance of being versatile. I take pride in the ability to wear a lot of hats, because I feel like you are able to adapt very quickly in changing environments. And especially in times like now with the economic conditions, you need to be indispensable, which means being a strategist, one moment, but being a tactician the next. And my approach to how I become versatile is through continuous learning and just situational awareness in general, keeping abreast of, industry trends, technological advancements, and just having a lot of conversations with individuals and just staying ahead of the curve. And I've used the term, whether it's versatility or just being literate in a lot of different areas, it allows you to understand the different perspectives so you can actually create and tackle new solutions as well. And the third one, which, I mean, I don't remember what exactly I called it, but, it's essentially kind of getting shit done, right? And it's about being pragmatic. And that is skill that a lot of people don't talk about. But there was a couple of years ago when Obama actually had an interview. This is Barack Obama had an interview, and he was asked, what's the best career advice you can give to an individual? And he said, in every area, people are really good at describing the problem and breaking it down and challenges and so on. But the best advice he can give is, be the person who says, let me take care of that. And it's a combination of not just what needs to be done, but it's, not waiting for permission and saying that I don't know exactly how to get it done right now, but I know I will. And that's an attitude, a mindset that irrespective of if you are a doer, leader, whatever you want to call yourself, it will always be valued. And people tend to gravitate towards people like that. So yeah, these are some of the attributes that I feel like are important for a leader. For me as a leader, at least.
I appreciate you sharing those three things, and you're absolutely correct. We're chatting with multiple leaders as well. They're like the ability to get shit done and actually figure it out instead of waiting for someone to guide you constantly, I think is very, very powerful given the rate in which everything is changing, right? So I'm going to switch a little bit towards your zone of genius. The biggest thing I'm going to focus on for you right now then is how is AI impacting healthcare? What are one of the biggest trends that you're noticing right now when it comes to AI and how it's transforming patient care?
Yeah, it's a fantastic question. Now, obviously, AI in healthcare is profoundly impacting the ecosystem and just leadership just in general. And now with the growth of generative AI, I feel like it is something that is much more accessible by the lay population as well, right? And it makes it quite exciting because there are some people that who feel like we're in the hype cycle. If we're in the hype cycle, we've been in the hype cycle for 18 months, and it's still continuing to grow. Whether you call it a hype cycle or you don't call it a hype cycle, it's the ability to know that there's a lot of investments being made, and we're starting to see dramatic changes. And the first and foremost, just in AI and healthcare, one of the most fascinating things that that's actually happening is the ability to make data-driven decision making at a whole different level. That's what AI enables, whether it's physicians or healthcare administrators or CEOs. It allows you to make decisions um, about patients and the type of treatments that they end up getting, just based on a vast amount of data from patient health records to treatment outcomes, that is much faster and more accurately than humanly possible. So if you're getting diagnosed, imagine getting a diagnosis much faster. And how often do we hear that it takes sometimes years for the accurate diagnosis to come, which means you've been managed poorly throughout that time, which means your outcomes have actually gotten worse as a result of it because it's taken so long. And there's certain conditions like AXPA, which is back pain, which ends up getting misdiagnosed for years and years, for example, right? So now imagine being able to identify, diagnose much faster and get the treatment much faster, which means less burden on the system in terms of cost, because you are not trying to actually figure out what works and what doesn't throughout the 10 years. So that becomes that becomes quite huge. And that's kind of laying the foundation for, smart diagnostics and personalized medicine, which is pushing, healthcare organizations to innovate, beyond beyond the traditional means as well. The other thing I'm quite interested in as well is around operational efficiency, and obviously that doesn't sound sexy, but ultimately, anytime we can transform healthcare operations by just automating things or optimizing everything from patient flow to inventory management, it creates a significant efficiency. And some people will think of it as like, well, that's great in terms of cost, but what does it mean in terms of patient care? But anytime you make things more efficient for physicians, administrators, you are alleviating time that they were spending on all of these type of manual tasks, which is in service of patient care, but it doesn't directly impact patient care. Now you're taking all that time away to say it's all being taken care of by AI. And now I can use my staff, my clinicians, to focus on maintaining high standards of care, which is what they should be doing. And one of the best examples I love to use is just in terms of what we've done with digitizing patient records. Over time, 10, 15, or 20 years ago, when we really started getting into this game, it was amazing that we're going from paper records to digitizing records. And now that's going to, optimize things much more. But if anything, we've made it worse. We now digitize everything and collect every information under the sun, which means a physician, and I'm sure, you've gone to a doctor's office where a physician is talking to you, but they're also typing a whole bunch of information at the same time. And what that does is it actually impacts patient care because they're spending 2 times more time in documenting your record versus actually talking to you. And that's a shift that we want to make in terms of let's get away from that documentation and maybe use AI to potentially have a speaker, some sort of device in the room, which collects the information in real time and actually puts it into the document itself. So the doctor actually can focus on spending more time with you. And if we're alleviating, twice more time from the doctors who are spending on documentation, that's being able to either see 3 times more patients, or it's actually being able to see you for 3 times as longer, which I think is actually quite important in terms of standards of care as well. So yeah, those are some of the biggest things that I'm excited about. And all of this is, at the heart of what AI offers is being able to engage patients much more differently and just improve their outcomes, which is what we're doing, at the end of the day within healthcare.
When it comes to AI and the speaker example that you had mentioned about, I know sometimes individuals are really concerned about privacy and all that. So, what would you say is one of the biggest misconceptions that you've heard about when it comes to AI in healthcare that you can potentially debunk?
So just in terms of the ethical considerations, as AI becomes more integrated into healthcare, obviously, leaders, including myself, have to navigate with any sort of ethical implications. The biggest part of the ethical implications that we worry about is around privacy, just in terms of using your data and what does that actually mean in terms of impacting your care. And making sure that we are safeguarding the data that you have actually provided us. There's other impacts that we worry about quite a bit, including bias in AI algorithms. We've heard, significant gender biases, significant racial biases coming from AI algorithms. And the result of that is because the data that we've generally collected is also biased. And anytime you introduce biased data into an AI algorithm, if anything, it magnifies it. That's where a lot of the ethical considerations come in, where there's a lot of innovation just around how we navigate around it. But leaders have to also establish clear guidelines and governance structures to manage, these type of ethical considerations actually quite a bit. But one of the you asked about, like, what are some of the biggest misconceptions that come in. I think it's the whole idea that AI is just a black box, that you have no idea what's exactly happening. And I think the reason people think AI is a black box is because a lot of times when you interface with some sort of digital device which has an AI algorithm, you don't know actually what's actually happening within it. And that gives that perception that it's a black box. Of course, there's many ways that to decipher exactly what's happening and how it's actually being being addressed. And one of the best ways that we can actually clear that misconception is by making things a little bit more transparent in terms of what type of data that has been used to get to these type of results and what are the implications of some of those decisions as well, so that you as an individual can understand like what type of data is being used to actually create some of some of the responses that we end up basically seeing as well. So I think that's one of the biggest misconceptions. The other misconception I do want to also highlight is AI unfortunately has an extremely high bar for accuracy. And what I mean by that is when human being makes errors, let's say errors with medical interventions or errors with, driving cars, a lot of time that's attributed to that individual. And we need to think about how we train the individuals, how they learn from it, and so on. But I think fundamentally with AI, if there's one mistake, it will end up being in the news that there has been this one self-driving car that got in an accident. And what that does, it actually creates a movement where it actually makes the industry go behind because there's a lot more scrutiny. And I feel like we definitely need scrutiny, but I do feel like we need to test and learn along the way. And I'm not saying that we need to end up having accidents to, make that happen because there's a significant amount of training. But how do we get to a point that we actually trust these algorithms to make some errors so that we can use those errors to actually make better decisions as well? And that misconception around it needs to be perfect is something that we need to understand. Like, this is a journey that we're going to be in, and if we're not going to be part of that journey, then we're going to end up being seeing setbacks within the industry to actually employ.
Okay, I appreciate you debunking those misconceptions and elaborating on that. And then as we slowly wrap up our conversation, what would you say is one of the biggest challenges that leaders are facing within this space? So AI and healthcare, and really imagining what the future of work could look like as a result of that.
I mean, you ask a good question because this could be, leadership in AI or just leadership in general, just in terms of, how you navigate some challenges. Ultimately, right now, we are in a tough economic climate and it becomes quite tough to navigate around complexities with vision. There's complexities just in terms of being resilient and also just, having appropriate courage as well. And when I talk about these kind of different elements, especially with vision, whether it's an AI or whether it's in other areas as well, crafting and sustaining a vision that resonates with everyone is going to be quite important. So whether it's in AI, whether it's in healthcare, a leader's primary role is to set a direction that not only inspires but also aligns with the core values and goals of an organization. So in AI specifically, it's about painting a picture of the future that excites and motivates everyone, and that every step and decision taken by your organization needs to help you move closer to that shared horizon. And I think of OpenAI has done a fantastic job about that in terms of they want to really revolutionize the future with AI. And what they have actually done is they have actually provided constant communication, engagement, and sometimes even realigning just in terms of where they're actually going. And that you need a powerful vision as a leader to be able to do that. And I think that's going to be important for any organization as well. Second thing with AI and just broader within healthcare itself is around maintaining that team motivation and culture. And this is where the resilience that I was mentioning really does come into play, especially in times of uncertainty. Leadership involves, fostering a positive, inclusive, resilient workplace culture that can withstand the ebbs and flows of these business cycles, right? We are still trying to innovate within AI. We're still trying to innovate within healthcare. And we need to be able to motivate the teams through the challenges that we're actually facing as well, which is where resilience really needs to come into play. And then the last one, which I mentioned, was around courage. And when I think about courage, I think about the ability to make tough decisions. As a leader, you're always going to be challenged in terms of decisions you make. Leadership will always test your mettle. It'll test your values. Whether it's making bold strategic bets, kind of like what OpenAI or Microsoft has actually done, whether it's navigating the economic downturns that I mentioned, whether it's making unpopular decisions for the greater good. And these moments demand courage. It demands foresight. It demands adherence to ethical standards as well. And this is where you need to weigh the immediate impacts against long-term benefits, and it requires sacrificing short-term gains for sustainable success as well. And a good example, as much as he's getting a lot of flack in the news recently, is Elon Musk. He has made a lot of long-term bets about using SpaceX to go to Mars, for example, and how he's balancing the short-term gains for sustainable success. He's not on a journey that he's thinking about sustainability or making money within the next 10, 20 years in that endeavor, but it's around what does it mean for the future, I was going to say this country, but this planet. And it's how he wants to define his legacy as a leader. And this is, kind of putting a lot of the personal stuff that he has his type of endured over the last few years and putting those aside as well. But yeah, like in embracing these type of challenges, this is where leaders can actually transform these obstacles into stepping stones. And this is these moments, which I talk about, courage, resilience, forgetting what the first one, the vision as well. This is where, it ultimately demonstrates the strength and the character and the effectiveness of a leader. And this has to be sustained, in that whole journey.
I appreciate you sharing that. And when it comes to then unleashing the potential of individuals and organizations, what's the first thing that comes to mind for you?
I think the first thing that comes to mind, I don't know why I'm thinking about, what Simon Sinek mentioned around the infinite game. It's around adopting an infinite mindset. And, this principle is just, beyond just looking at short-term targets and understand that real success is a continuous journey. And for individuals, it means setting milestones. And I use milestones and not goals because goals tend to be quite finite. And these milestones are just not reaching a point, but it's about ongoing improvement and always asking, how can I get better? As an individual, if it's an organization, it's around how do I keep evolving? How do I keep innovating? Because adaptability is quite important in an ever-changing world. And this is a mindset that I think is important to constantly progressing and innovating. And this resonates, the infinite game, I remember it resonated really well with me because my personal purpose has always been to be a better version of myself with every passing day. And I'm always striving for improvement, whether, it's a consultant or a father, a husband or son, right? And to me, that is probably one of the most important principles that you can employ to unleash that potential at the end of the day.
Thank you. I'm going to add that to my reading list. And my last question to you is, what is one thing you're working on that you're excited about, or potentially what's top of mind for you so that others can understand how they could potentially help you?
That's yeah, it's a loaded question just in terms of what's on top of my mind because there's so many things on top of my mind as well, right? And I mean, this may sound a little bit grandiose, but what's always on top of mind for me is how do I make a dent in Canada and change it for the better? And right now, it's through my passion and my work in healthcare. And right now, I'm a strong believer that to be able to truly create any sort of reforms in healthcare, whether it's in Canada or globally, you need to bring in kind of the collective strength of the ecosystem to be able to do that, which means bringing public and private sector together, where these sectors, often work in silos, but they hold different pieces of the puzzle and they're all critical to one another's success. And they also all have different interaction with the patients, right? So this is where I feel like whether irrespective of the organization, labs, public sector, government, pharmaceutical companies, I spend a lot of times around how do I bring them together to unlock the synergies and work on big transformational initiatives. And to be able to do that, what you really need is the coalition of the willing, which means groups and individuals, obviously those organizations who are capable of doing it and want to see a change, but also at every level, seeing just people who are just passionate about making a real difference, which includes healthcare professionals, technology innovators, policymakers, community leaders, students who have a shared commitment to just a better society and a better healthcare ecosystem. And this is where it's a little bit of my call to action, I guess, for anyone listening to this, that if you share this passion for healthcare transformation, if you see immense potential in public-private partnership, figure out how to contribute. Let's connect. Let's figure out how we can explore and collaborate to make impactful changes, because I feel these are the type, it's the collective individuals and the passion that I feel like that really needs to come together to ignite a fire.
Thank you so much for the work that you are doing and the impact that you continue to make, and for sharing your insights with us today. And to everyone else that's tuned into another episode, thank you so much for your time and attention. It means more to me than you'll know, and I can't wait to stay in touch with you on my next episode. Till then, stay safe.